Now in this video we'll be discussing on the topic of general principles, types of operation in oncology. Okay, now operation meaning is surgery actually. Now surgery is the basis for the treatment of most types of oncopathologies, meaning the cancers. Basically the meaning is cancer. Now management of patients with oncopathology surgery is importantly includes three processes, that is diagnostic first of all, then therapeutic treatment, it can be surgery also, and palliative care to prolong the prolong the life the patients were suffering from the cancer. Now biology of tumor can be like direct infiltration of the cancer and the spread of cancer through lymphogenic metastasis or through blood, that is the hematogenous metastasis. Now for example, if we see the breast cancers and the colorectal cancer spread mostly through blood and through lymphatic, but the cancers of upper gastrointestinal and upper respiratory system spread through lymphatic pathway. So this is the important points you have to remember regarding the spread of the cancers, the biology of the cancer. Now what are the diagnosis and determinations of the tumor stage? The first step, what we do for the diagnosis. Now diagnosis of neoplasms of the cancers use surgical methods represented by biopsy. Now we have two types, like incisional biopsy and excisional biopsy. Incisional meaning is only a part of tumor is taken, and excision means entire tissue or organ is removed. As I show you in this image, you can see this is the biopsy, incisional biopsy, and image you can see this is excisional biopsy, this is an incisional. So the partial removal of skin tissue is called as incisional, but if the fully organ or full skin is removed where the cancer is developing, that area that method or that type of biopsy is called as excisional biopsy. Clear? Now therapeutic surgery we have. Now in therapeutic surgery, it is represented by radical operation or complete operation. Okay, complete operation aimed at complete removal of the tumor, and this is actually effective at the initial stages of the cancers. Now we have two terms, ablasty and antiblasty. Now let's see what is the meaning of these terms. So ablasty, this principle is developed to minimize the damaging effects of surgery on healthy tissues and organ. So these two principles are actually developed to minimize the side effects, you can say, or any damaging effects which can be through the operation of surgery to the healthy organs besides or nearby organs. So the ablasty is applied to operation in which along with tumor a complex of lymphatic vessel is removed. So during the surgery or during the operation of the tumor, if any lymphatic vessel is removed by mistake, then that term is actually called as ablasty. And opposite of that is called as antiblasty. It is used to prevent the spread of cancer beyond the neoplasm. So the meaning is that the antiblasty will prevent the spread of cancer beyond the neoplasm. So it will just be it will just keep the cancer confined to that area only. Now how you can prevent this? This you can prevent by doing the frequent change of surgical instruments while doing the surgery, and washing of the surgical wound with antiseptic solutions, and like appointment of chemo, radio, and these therapies during the surgery, before the surgery, or after the surgery. So these 3 points you should remember to prevent the spread of the cancer while doing the surgery. So that point is actually called as your antiblasty, and if it is not prevented, then that term is called as ablasty. Okay, so this is the main method. Now types of surgical interventions. We have open operational methods, which we actually do by doing the cut and just removing the part of the tumor, and that is invasive methods. Now we have some minimally invasive methods, and the advantage of these methods are like they have faster recoveries and less post-operative pains. The meaning is that after the operation there is less pain to the patient. Now we have 4 types: laparoscopy, the viewing of the abdomen, okay, laser surgery, cryo surgery, and endoscopy. Okay, now you can see the laser surgery. You can see this is the skin cancer, and this laser is being used here. You can see this for the removal of the cancer in the skin. Okay, so this is the treatment through the laser surgery for the patient with the skin cancer. And you can also see this Okay, so this you can see. Now what is the cryosurgery? Now cryosurgery is actually the patient who are actually use the liquid nitrogen in the place of the cancer. Like if there is any patient suffering for prostate cancer, then we put a metal with very cold metal, okay, and that metal we have liquid nitrogen or organ gas which we put inside the tumor, and through that coldness that we try to kill that tumor, and that process is actually called as cryosurgery. Okay, and endoscopy we also do to actually view the organs, okay, on the television screen and do the surgical treatment. And laparoscopy is for the fully viewing of your abdomen area, all the organs. Endoscopy, we have specific endoscopies like gastroscopy, okay, uteroscopy and all. If we are seeing the individual organ, then we use that word. Now palliative surgery, the palliative care aims to elevate the symptoms of oncopathology as much as possible, okay. And we have jaundice. In that we have jaundice. The mechanical jaundice can be relieved surgically by cholecystectomy and cholecystoenterostomy. So these are the two type of removal, like the intestines and the duct of the biliary duct, and here the gall duct and your intestine, enterostomy. So fully they are removed, and these are the treatment for the mechanical jaundice, surgical treatment. And stent can also be the treatment, but it can cause the repetitive blockage. So stenting is not the permanent solution. Now ascites is the meaning of ascites is accumulation of fluid in the abdomen. So for that we use actually peritoneal venous shunts are installed using local anesthesia, and with over 50% patients achieving a good long palliative care. So in this image you can see actually this is the Pareto venous shunt. So you can see this ascites, the abdomen is fully filled with the fluid, and here we actually put a valve under the muscle and the fascia by giving the anesthesia here. And what happens is that there is a catheter which actually collects all the fluid and drains it into the jugular vein. So that is why it is called as peritoneal venous shunt. So it is draining the peritoneal fluid from the abdomen to the jugular vein, or it can go to jugular vein if you connect that into jugular vein, or you can connect it to the superior vena cava. So this is your peritoneal venous shunt, okay. Now this was a treatment for ascites, and it has good prolonged palliative treatment with patients suffering from ascites. Now surgical treatment in the pain syndrome. For pain syndrome we have surgical removal of large and slow growing tumors directly. We can do stabilization of pathological fractures by timely removal of bone metastasis, and we can also do cordotomy, that is the operative intersection of spinal cord. So cordotomy can also be done to remove the pain syndrome. Now in the GI bleeding, like gastrointestinal bleeding, what surgical treatment we can do? We can give the injection sclerotherapy, which is the administration of drug that actually glues or narrows your vessels. Because of that the bleeding stops. Or you can also do laser coagulations or radiological embolization. So in this image you can see injection sclerotherapy. Here you can see this is a sclerotherapeutic needle which actually glues, and what you inject is your N-butyl 2 cyanoacrylate glue, which is injected. This you can see, this is your gastrointestinal tract, okay, gastric varix, and this is your gastroscope, from which you will be viewing your needle where to insert, okay. And one example is all of example for sclerotherapy vein treatment. You can see this is a sclerotic drug is injected on the varicose vein, causing the vein to collapse. So vein collapses, narrows, and which actually restricts the bleeding. And ultrasound is used to locate the affected vein. So we use the ultrasound to inject the needle, where to inject, actual position, okay. So thank you, this was the video.